Hi, good evening. I am Dr. Nandini Gokulchandran and I welcome all of you to this webinar this evening. I am the Deputy Director of NeuroGen Brain and Spine Institute. And today we are going to discuss about what is new in the treatment of mental disorders, which you commonly know as autism, cerebral palsy, intellectual disability. At NeuroGen, we focus on disorders of neurological conditions, disorders of the brain, spine, and the muscles, where there is no definitive treatment. So we are constantly evolving, looking at what new is possible. So I'm going to try and simplify the newer options for you so that it is more easy to understand and that you will be able to make informed decisions. Okay. So why are we here? Okay, on a weekday, week evening, and I'm sure you're all busy professionals. End of the day, you have all joined here either because you are parents or caretakers of children or individuals with special needs, or you are professionals who are taking care of them or helping guide them for improving their condition. So we are here to understand what new can we do for these children. So what is the current paradigm? What are the current treatment facts around neurological conditions and neurodevelopmental conditions? The first thing that you are told, I'm sure that you have heard this again and again from different doctors, not only in your country, but abroad also, that there is no cure for your children. That there is no surgery, no operation that can be done. Like, for example, if there is a brain tumor, you cut open the brain and remove the tumor. But in case of autism or cerebral palsy, there is no operation which can be done to help cure these children. That only thing that you have right now is neurorehabilitation. You have to continue doing therapy day after day, year after year, and that's the only option that you have. And that there are no medicines to cure a condition. This is not a malaria or a COVID that medicines will help. The medicines, if at all, can help symptomatically. So what have you heard? No cure, no operation, no cut opening, no surgery, only rehabilitation for your children and no medicines. This is what you have heard. This is what is the conventional current understanding. But what are we going to know today? What is new? What I want to tell you is that it is no longer true that children with autism or cerebral palsy cannot be treated. These children can be treated. And apart from rehabilitation, in your team, now you have two new additions, and that is cellular therapy or cell therapy, or you know it commonly as stem cell therapy, and integrative therapies or oxygen-based therapies. So what am I telling you? That you have a team so far which contains mainly of neurorehabilitation. And in your team now, we are adding these two new, young, very energetic members, that is cellular therapy and integrative therapy. And along with neurorehabilitation, this team now will become stronger and more efficient to help your children. So, for example, here in this picture, you are seeing on the left side that there is a leg which is fractured, right? So I think many of you would have experienced, or somebody in your family would have experienced some sort of a fracture, right? If your leg or hand is fractured, what would you do? Would you start doing exercise, physiotherapy, rehabilitation immediately? No. First, you would fix it. Either you would splint it or you get it surgically corrected, so that when after the bone heals, that's when you start the exercise or therapy. Similarly, in the case of brain, for example, here in the brain, you can see this is a scan of the brain known as a PET scan. The green, the yellow, and the red parts are normal or good functioning brain, and the blue areas indicate damage or low functioning brain. Okay, so what do you see in this other picture? That this part of the brain which is damaged is now healed. It is now fixed. And now, because this area is fixed, now you do training, now you do rehabilitation. Now the child will be able to respond better. What are we doing currently? What we are doing is that the child of the brain is damaged and we are pushing the brain. It's like if your leg is fractured and you do physiotherapy, what will happen? Or you walk with a fractured leg, your fracture will worsen. Similarly, a fractured brain or a damaged brain, when you push it, it revolts. And that's where you see the child is not able to respond and may actually worsen. So that's why it's important to improve the brain, heal the brain, treat the brain from inside so that the training and therapy that you are giving from outside will become more productive. And that is the essence of this newer treatments currently. So what is the old concept or old thought? That once the brain is damaged, once the central nervous system is damaged, it is incapable of regeneration. However, please note this is old thinking. Okay, let's go to the newer era. We are in the 21st century. We are in the era of going to the space. So, so many possibilities are there. The new thought process, the new thinking is that regeneration is possible. It is possible that through the process of cellular replacement, by giving cells to the brain, it is possible to repair and regenerate a damaged brain. So till now, what did we have? We had only rehabilitation. And now, along with rehabilitation, we have cellular therapy, we have integrative therapy, and together these three form a very solid team, and rehab, cellular therapy, and integrative therapy together will it's now possible to reverse autism and cerebral palsy with a combination of these three. So this is a very exciting period of medicine, of exciting period of regenerative science, which can help reverse the damage in the brain. So cellular therapy is not a science fiction. It is not futuristic. It is an idea whose time has come. It is possible right now. So what are the paradigms that we know so far? If there is a problem or if there is a condition, medical condition, what do we do? There are two possibilities. One possibility is that you either have medicines or you have injections. So you have either drugs or you have injections. That is one part. The other part is you have a surgical procedure. You cut open, you stitch back, you remove. So either you have medicines or you have surgery. But this new concept that I'm going to introduce is known as cellular therapy. This is neither a surgery nor it is a medicine. It is a part of regenerative medicine known as cell-based therapies. So this is a new option. This is a new treatment which is now being used for the last 15 years at NeuroGen Brain and Spine Institute for neurological conditions. So this is helping us bring a lot of hope to those who are hopeless. It is helping bring those who are walking or sitting on a wheelchair to stand and walk. Those children who are unable to go to school and study. Those who are unable to function independently to function more independently. So, for example, here you can see a stem of a tree, right? The stem of a tree, what does it do? If you give it water properly and fertilizer, it gives rise to leaves and branches and then fruits. So similarly, there are cells in our body. Stephen Hawking is talking about it. Let's listen to what he has to say.
I have spent my life exploring the mysteries of the cosmos. But there's another universe that fascinates me. The one hidden inside our bodies. Our own personal galaxies of cells. Today, we are on the brink of a new age in medicine. An age where we will be able to heal our bodies of any illness. All because of cells inside us, which have special powers.
They are called stem cells.
So this is the special power in our own body. Okay, we don't need it to get from outside. It is right there in our body. And this personal galaxies of cells, as Stephen Hawking says, this personal galaxy of cell will help to rejuvenate our brain and our body. So what does these cells do? What is the speciality of these stem cells? The speciality is that they have the potential to multiply. Okay, one cell can become many, many, many cells. So thousands of cells. That is one of the main characteristics of stem cells. Second is that they improve blood supply in our body wherever we put them. So, for example, if you put them in the brain, they help improve the brain circulation or improve the brain blood flow. If you put them in the liver, they help improve the blood flow in the liver. So, and thereby improving oxygenation in that part of the body and helping the repair process. The third it does is it can convert into other type of cells. If you put them in the heart, it can become heart-like cells. If you put them in the bone, it can become bone-like cells. And the fourth that you do is it release positive chemicals. There is release of growth factors, release of chemicals, which will help improve the regeneration of that particular part. So these are the specialities or special ways that stem cells work. So they can repair, regenerate, and replace the damaged tissue. So how are the stem cells different from a drug or a surgery? So if you look about, say, 10 to 30, 20, 25 years back, or about 30 years back, way back in 1990s, suppose you had to do some calculation, you would need a calculator, right? Suppose you had to, in a dark place, you needed some light, so you would need a flashlight or a torchlight. To read books, you needed to actually physically open a book and read or buy a book. If you needed to click pictures, and you needed like a Kodak or a Conan camera. If you needed to look at the time, you needed a watch or a clock. So that was about 30 years back, right? Now, if you think of what do you have? You have either Android phone or iPhone, which can do all of these functions, isn't it? So what you have is a multitasker right in your hand. And that's what the stem cells are. They are multifunctional, multitask. So they combine the effect of many, many medications together so that you don't need to really give medicines, not so many. Right? So stem cells are special cells which have multiple functions and multiple actions. And that's where their beauty and their efficiency lies. So the field of regenerative medicine, regeneration of what is lost, uses special cells or cellular components which can replace or repair the damaged cells in the body. I'm going to talk in reference to the brain because we are talking about neurological conditions. So you have the brain here, and the blue or darker blue areas are damaged part. The cells are going there. They are helping repair the damage and improve the brain functioning. Now, the cellular therapy can be of two types. If we take cells from our own body, our own personal galaxy of cells, and put it back in our body, it is known as autologous transplantation. And if we take cells from outside and put it in our body, it is known as allogenic. So there are two ways. Either you can take cells from your own body, or you can take cells from outside. So depending on where you take the cells from, their pros and cons, their positives or negatives will depend on that. So if we look at stem cells, where do we get them from? Can we go anywhere, go to the shop and buy it? No. As of now, at least we cannot go and buy it in a shop. Maybe in the future, that may be an option. So we get cells from our own body. First of all, when we were in our mother's womb, we were a one cell stage. And that one cell divided into many, many cells, a group of cells, about 32 cells. And from there, in the laboratory, when these cells are grown, you get embryonic stem cells. The speciality of embryonic stem cell is that from these bunch of cells, a whole embryo can be formed. So they have a lot of potential. However, there are two issues. One, there is ethical issue that you are killing an embryo because these are fertilized embryo and can give rise to life. So that is one ethical option. Many human rights issues or questions are raised on this particular type of stem cell. The other thing is that they form tumors in the brain or in the body when they are injected, and that's why scientifically or medically, because of these two reasons, embryonic stem cells cannot be used for clinical purpose, for treatment purpose. So no embryonic stem cells for treatment. But yes, it's a very good research tool. The second part is the umbilical cord blood stem cells. The umbilical cord blood stem cells, you would all know that when a child is in the mother's womb, is connected to the mother using by a cord. And when the child comes out, this we cut the cord, right? And whatever cord is remaining, we just put it into the dustbin. So this cord is a very good source of stem cells, and it can be stored like we store blood. It can be stored in cord blood banks, and it can be retrieved when required. These are good sources so far, have been well established for blood disorders or hematopoietic disorders. The third part, when we don't have cord blood or we don't have can't use embryonic stem cell, then what do we have? We do have our own personal cells. We have cells in our own body. We have the bone marrow, which keeps on producing newer cells, blood all the time, and produces blood because there are stem cells in the bone marrow. So that is the most common and most understood source of stem cells from our own body. So if I have a brain problem, I can use my own bone marrow cells to improve my brain function. If I have a wound which is not healing, or if I have arthritis, I can still use my own bone marrow cells. So we're using this source to improve the brain functioning. The beauty of this is that there are no ethical issues. We are not killing an embryo. There is no chance of forming any tumor in adult stem cells taken from the bone marrow. So they can be used, their thumbs up, for treatment purposes. So when we say that stem cells are dangerous, they're toxic, they form tumors, what are we doing? We are putting all type of cells into one basket. We need to understand the difference. Embryonic stem cell is like alcohol, while adult stem cells taken from the child's own bone marrow is like homemade orange juice made by mother. It's never going to harm a child, isn't it? So at NeuroGen, we choose to work with adult stem cells, and the reason is that, number one, it is safe. There are no tumor formation. There is no, as I said, no tumor formation, no rejection. It is our own cells, so no rejection from the child, goes back to the child. So very, very safe. Easily obtainable. I will show you how it is obtained using a very, very thin needle. The needle is thinner than the tip of this pen. Okay, so as thin as that, very easily obtainable. No ethical issues. We are not killing an embryo, so no ethical issues. And as I said, we take from the bone marrow and we inject the cells where we want it to reach as close to the brain as possible. So we cannot inject directly into the brain because that would be risky. So we are injecting here in the lower back into the spinal fluid, and with the fluid, the cells reach the brain. So we are injecting into the lower back using a very, very thin needle. So this process, it's called minimally invasive, using a very thin needle. It is safe. There are no cut, no stitches, no major side effects. The cells will go directly to the part of the brain which is damaged. And because we are not injecting into the IV, they do not go anywhere else in the body, do not go into the lungs, liver, or spleen, because we are injecting directly into the vicinity or near the brain. So what is the scientific basis for cell therapy or stem cell therapy or stem cell research? Is it something which has just started yesterday? No, this is something which has a lot of research has been done. And way back in 1990, Dr. Thomas was awarded the first Nobel Prize for stem cell research for demonstrating what we actually use now, stem cells in the bone marrow. The second Nobel Prize, which is is the biggest award in the world, that was given in 2007 to Sir Martin Ewens for the isolation of embryonic stem cells in the mice. And recently in 2012, about 11 years back, Professor Shinya Yamanaka and Professor John Gurdon from Japan and US respectively, they were given a Nobel Prize. They shared a Nobel Prize for this new concept of induced pluripotent stem cells, that is our own cells, our skin cells, for example, being reprogrammed to become embryonic cells. So no ethical issues there if we use the skin cells. But this is still in progress. So there is a lot of research which has happened. And at NeuroGen, that is at NeuroGen Brain and Spine Institute, which is in India, in Mumbai, the scientific basis of the work that we do is more than 100 plus scientific publications. Why scientific publications are important? Because scientific publications authenticate the work that we do. It increases the credibility because it is reviewed by our peers of the or experts in the same field. So this is not like a a newspaper article or a magazine article. This is scientific publications which gives credibility to the work that we have done. So we have more than 100, 16 in autism, 15 in cerebral palsy, 4 in intellectual disability, 18 in muscular dystrophy, 9 in spinal cord injury, 6 in brain stroke, 11 in amyotrophic lateral sclerosis or motor neuron disease. So all work that we do, we also research it and we publish it. Because of the work that we do and our expertise in the field of cellular therapy and regenerative medicine, now we have been invited to write book chapters in various international books. For example, the recent advances in autism, we have written a book chapter on stem cell therapy in autism spectrum disorder. In an international book published by InTech, book known as Cerebral Palsy, Challenges for the Future, we have been invited to write a book on stem cell therapy for cerebral palsy. Physical disabilities, a book on physical disabilities. We've written chapter on neurological disabilities and stem cells. This is our Prime Minister, Honorable Shri Narendra Modi, who is a big support of stem cell research and stem cell treatment and regenerative medicine. Our director, Professor Alok Sharma, the neurosurgeon, is giving the book that we have written, presenting it to the Honorable Prime Minister. Prime Minister also has gone and visited Professor Shinya Yamanaka in Japan to go and understand how this technology can be brought to India, and has established a research center in the city of Bangalore. He's written a book, preface for one of our books on muscular dystrophy, and this is what he's
Japan
in the parliament.
तो जापान मेरे कार्यक्रम में मैंने एक कार्यक्रम क्या जोड़ा, मैं वहां एक नोबेल लॉरिएट साइंटिस्ट यामाहा को मिलने गया। मैं इसलिए किया गया कि उन्होंने स्टेम सेल के अंदर जो रिसर्च की है, मैंने जितना पढ़ा था तो मेरे मन में आया था शायद इनकी एक खोज हमारे काम आ सकती है क्या है। हम गए तो वहां गए, उनसे चर्चा की और बेंगलोर के हमारे साइंस इंस्टीट्यूट के साथ आज उस दिशा में हमारा काम हो रहा है कि स्टेम सेल्स के द्वारा हमारे युवा साइंटिस्ट कुछ खोज करें।
So he is talking about this center in Bangalore and the potential of stem cell. So now that we have understood the background of the cellular cells and the stem cells, special cells that are being used for regeneration, let's see how the treatment is done. Most parents, of course, want to know how is the treatment? Is it painful? Is it a big surgery? Is it a major surgical procedure? Is there cut? Is there stitches? I can assure you there is nothing major. Okay, the simple treatment is simple, it is safe, it is effective. So bone marrow, as I said, is aspirated from the hip bone. You can see here the hip bone marrow using a very thin needle. Then the cells are separated in the laboratory and then injected into the lower back. So for the patient, it is just 2 injections, 1 needle in the hip bone, 1 needle in the back, all done under sedation. The child is sleeping, will not feel any pain during the procedure. The aspiration is a 10-minute procedure. Injection is again a 5 to 10-minute procedure. And in between, the cells are separated, takes a few hours, which takes place in the laboratory within the operation theater complex. So this is how the cell transplantation happens. This is the bone marrow. It is thick blood-like organs. Bone marrow separated, cells are separated, and then injected into the lower back. So this is the process, very simple, very safe, no cut, no stitches. Bone marrow aspirated, being centrifuged in the laboratory. This is how it looks, the final product, and checked, diluted, and injected in the lower back. So this is about the first team member that we have added, that is the cellular therapy. If you remember, we also added one more team member, and that is known as the integrative therapy or oxygen-based therapy. And let's understand a little bit about it, because when we do put all of these 3 together, our treatment becomes very strong, very efficient. So what are oxygen-based therapy? This is a new concept last few years that has been introduced and known as integrative therapy. Okay. So the one member of this integrative therapy is hyperbaric oxygen therapy. You can see this space shuttle kind of a machine here, and Most children love this machine because they feel they are in a spaceship and going on a rocket, and they feel like that's how they feel, and they enjoy it because you can see a television above there, and that is their screen time which they love. So let me first make you understand the concept of what it is. Simply put, what is happening here? This what you are seeing here on the top part of the screen is the artery. Okay, this is what is an artery. Artery is the pipe which takes blood or gives blood to our body. When the heart pumps blood, the blood goes to all parts of the body through different arteries. Okay, the artery is the conduit for the blood. So what you see here are the red blood cells, right? Inside the red blood cell, what you are seeing here is the oxygen molecule. Okay, so when we are breathing 20% oxygen at 1 atmosphere pressure. There's a normal pressure, and in this normal pressure, when we breathe oxygen inside, it gets filtered by the lungs, and then it goes into the bloodstream. It is carried only by the red blood cells. You will not see oxygen in the plasma or in the white cells. You see the oxygen only in the red blood cells, in the hemoglobin. Okay, so in hyperbaric oxygen or hyperbaric processes, we give 100% oxygen at increasing pressure. So the pressure increases from 1 to 1.3 to 1.5, 0.8, and pressure over 1.5, the oxygen you can see in the lower picture here diffuses into the plasma. You can see so much oxygen. Apart from the red blood cells, now the plasma also carries the oxygen, and we all know that oxygen is the healing molecule of our body. We need oxygen to be alive, and here we are flooding our system with oxygen. Everything from the tip of the hair, root of the hair, to the root of the nail. Every place where even cells cannot go is now flooded with oxygen, and this helps now to stimulate the repair. It stimulates the stem cells that have been injected. It improves oxygenation in the body, and thereby it helps access the damaged part and help repair it. It also helps in improving the aging process, helping us to age more gracefully, our body becoming more rejuvenated. So this is how, because children are afraid to be in closed spaces, along with the child, adult or a parent also goes into the hyperbaric chamber. So hyperbaric oxygen therapy has been, it has been seen that it helps to prevent the cells from dying or senescence, and helps improve the body, our biological health. It also helps to recover from any muscle injury. Has been used so far to treat sports-related injuries. It has been used also to treat any damage due to physical exercise in women. It has been also been studied in autism, where it's been found to help children with autism. It has been, 2 studies have been done. It has also been seen to stimulate these stem cells which have been injected in a spinal cord injury model, rat model. It has been found that hyperbaric oxygen also improves stem cell mobilization in the body. So it has multiple action, and we use it along with cell therapy in children as well as in adults. In few cases, we cannot use hyperbaric oxygen when there are active fits or seizures. If there is a metal implant in the body which is outside, okay, like you may have like a dentition or some visible implant outside, or there is ear perforation, there is an infection in the inner ear, or if your lungs are very bad or very severe low functioning of the heart, or if you're on oxygen support, there is ear discharge, and you don't like closed places. Mainly in children, 2 things: active fits, seizures or epilepsy, and number 2, if there is a ear discharge. These are the most 2 practical possibilities when hyperbaric oxygen cannot be offered. This is the way it is done. This is how the stretch part comes out. And now this individual go inside and lie down very comfortably, very happily. Then the door is closed and is connected or grounded using a grounding technique here, so that it doesn't get electrocuted. And then here it is closing the door of the hyperbaric chamber. Now they start the machine. The machine pressure builds up over 5 to 6 minutes, and you can see he's comfortably lying down and watching the television there. So, 40 to 45 minutes, 1 hour just goes by fast. Temperature once built up, it remains steady for about half an hour, 45 minutes. And then when you want to stop, slowly it is stopped and the pressure comes down. When pressure comes to 1 atmosphere, the atmospheric pressure, then the door is open. Door cannot be opened in between. So that was about hyperbaric oxygen. Let's understand about ozone therapy. This is also a form of oxygenation. Both hyperbaric oxygen therapy and ozone therapy help in oxidation or basically helps in oxygenation. However, the mechanism is different. Ozone is basically medical ozone. So we all know oxygen O2, that is the medical oxygen in cylinders. You can see here ozonator. Medical oxygen will go through this pipe into the ozonator and comes out through this tube as another form of gas, which is O3, which is medical ozone, and which is an activated form of ozone. So activated form of ozone helps in as an antioxidant. It helps reduce inflammation. It helps to thin the blood so that more oxygen can reach various parts of the body. It is a very natural germicidal. It kills bacteria, virus, fungus, and parasites. Okay, so as an antioxidant, and it can be given through various routes. In children, it can be given as through the stethoscope into the ear. Through the ear, directly reaches the brain. So very good way. The other it can be done is by rectal insufflation. That means as a enema through the anal route. That helps to improve the gut as well as gets absorbed very nicely from the gut. For those who have some like sinusitis or congestion, BOTO, that is the breathing of ozone through oil, can be done. It can be given, it can be given locally where there is a wound. So depending on the indication, the route of administration will differ. This is example of a ear insufflation. You can see that the individual stethoscope is put through ear and then oxygen or ozone passes through. This is known as BOTO, or breathing ozone through oil. This is ozone sauna, like we take steam or sauna. Similarly, ozone sauna can be done. This is in COVID, we used IV ozone saline. There are a lot of clinical applications of ozone which are known. The ozone therapy is given. You can see oxygen goes through, comes out as O3. O3 is active or activated oxygen, and you can see that. Third part of increasing oxygenation is acupressure, deep tissue mobilization by giving pressure at certain points helps relax the patient or the child, improves oxygenation, improves the lymphatic vessel circulation, and thereby improves and helps relieve muscle tension, improves circulation, improves aerobic health. So in neurodevelopmental disorder, along with cell therapy, we suggest at least 10 hyperbaric oxygen, ozone, and deep tissue mobilization. And in neurodegenerative condition or in adults, we also add gut cleansing and IV vitamins. So let's look at results in autism of cellular therapy with rehabilitation and cellular therapy with oxygen-based therapy and rehabilitation. So we will see all of that. We know what autism is. I don't need to tell you, but in brief, autism is a neurodevelopmental disorder. It seems to occur more in boys than in girls, and it's a spectrum. So basically, typically when the brain is developing, there is a problem, and mainly there can be 3 issues: poor social interaction, impaired communication, can be verbal communication, non-verbal both, and restricted repetitive behavior. So prevalence of autism, it is increasing day by day. In the last 20 years, it has increased almost, from 1 in 166 to 1 in 40 now. Almost 70 million people in the world are on the spectrum and 1% of world population, and hence we need to find a definitive solution. Though we don't know the exact cause of autism, it could be either genetic or it could be environmental or it could be a combination of both. Genetic, we do know that there are certain gene deletions or mutations which could be associated. We have seen in siblings, autism in siblings, in triplets as well. And there are different mutations which could, however, not all children are the same, and even if there is a mutation, may not lead to autism. So somewhere environmental factors do play a major role, such as there can be stress during pregnancy or oxygen deprivation during or when the child is coming out, or postnatal causes. There can be a problem of the intestinal issue in the mother, leading to brain development issues in the child, exposure to toxic chemicals, and use of mobile phones and electromagnetic radiation. These are a few possible causes which add on to triggering of autism. So when we look at what is new, we look at how we understand autism better through brain imaging. I will talk a little bit of that, and cellular therapy for autism, which I talked about a little bit. I will show you the results. Now, PET scan is a brain scan which is done to understand functioning of the brain. Because by and large, when you do an MRI of the brain, broadly the brain appears to be fine. Though we have now established and published that connections of the brain may also be affected. But majorly, we now use PET scan to see the functioning of the brain. How strong is the brain? Which part of the brain is weak? And when we look at the brain functioning, this is a PET scan. You can see the side view of the brain. This is a side view. So this is the front of the brain. If you can see the cursor, top of the brain and back of the brain, and back and below. The green, yellow, and red part indicates good functioning brain. And the blue part here indicates the lower functioning. Darker the blue, lesser the functioning. And this has been published in the World Journal of Nuclear Medicine way back in 2018. And what they typically show is that when you look at the brain functioning, the orange here indicates children with autism, the brain functioning in children with autism, and the blue indicates brain functioning in children without autism, children, neurotypical children. And the blue, you can see the graph is going up. That means brain functioning is increasing fast up till 10 years. Further to that, it increases, however, slow. In children with autism, you can see that the brain functioning initially was high and then it keeps going down. So this is a point where we see there is a crossing, and what we believe, and it has been internationally and generally accepted, is that early intervention. That means that you need to push this graph up, and earlier you push, lesser area that you have to travel, or lesser time that you have to travel. So you can see that as the age increases, okay, the gap between normal and neurotypical and autism increases, or neurodiverse increases. So earlier you treat, better that you can help to reverse the autism. So what does management of autism really need? It needs a multidisciplinary approach. It needs all the rehabilitation therapies, applied behavior analysis, speech therapy, art-based therapy, occupational therapy, diet, physical therapy, animal-assisted therapy, aquatic therapy, but also in addition requires cellular therapy and hyperbaric therapy. Neurorehabilitation, we know the whole team member, but let us just revise what is required. Applied behavioral analysis, physiotherapy, occupational therapy, sensory integration therapy, speech therapy. We do all of that here. Aquatic therapy, therapy in water. Children love water. Art-based therapy. Some people also believe that there is heavy metal issues, so chelation or TRS, vitamin supplements. These are all because children sometimes are picky eaters, so they don't want to eat, and hence vitamins. Diet and nutrition, gluten-free, casein-free diet can also help. Gluten-free, casein-free diet helps in reducing the gas formation, improving absorption of the nutrition, as well as reducing constipation. But however, with all of this, we always wonder, are we doing enough? Is rehabilitation enough? That's why we have added the cellular therapy and the integrated therapy. When we do this together, then we improve the brain functioning, thereby making neurorehabilitation more effective. So let's look at what is the evidence for cell therapy. First, I'm going to tell you our experience, which we have published in international journals, first only on cell therapy, and then I'm going to talk about how the combination of cell therapy with hyperbaric oxygen. So, cell therapy, stem cells in autism. This was published in Stem Cell International Journal. First ever publication in the world came from NeuroGen, where we showed that bone marrow, source of cells from the bone marrow, helps improve brain functioning in children with autism. This was about 32 children that we published, and we saw improvement in all different domains where there can be affectation. The second publication came in 2020, and we published it in the American Journal of Stem Cells, where we looked at 254 children over a period of 7.5 months. And we found that there was improvement in social interaction, improvement in eye contact, attention concentration, stereotypical behavior reduced, aggressiveness increased, hyperactivity reduced, aggressiveness reduced, self-injurious behavior reduced, sitting tolerance improved, command following improved, speech and communication became better. And we found that the clinical scores also showed significant improvement. We found that severity, both mild, moderate, and severe, do improve. What was most striking, and which I would like to emphasize here, is the age. We find earlier we treat, better the results. So less than 5 years have the best possible outcome, almost 97 to 98%. That means out of 100, 98 to 99 would show improvement, 1 or 2 may not improve. So I think that's a great result. Then 5 to 10 years, about 94% is the success rate, and above 10 years, it goes down to 90%. So as the age increases, the possibility of success, even using cell therapy, will reduce, because the brain is more pliable when the child is younger, brain is more flexible, and you can do more, training at younger age. Both males and females show equal improvement. And when we look at duration from diagnosis to intervention, we see that younger children, earlier you bring better the results. So if you diagnose a child today, and if you do the treatment less than a year after diagnosis, almost 100% possibility that your child will show improvement. But if you bring later, after 5 years, the possibility becomes less, about 90%. So these are all the scientific evidences. First publication came from India, second from China, third from Italy, fourth and fifth from US, sixth again from NeuroGen, and seventh from Vietnam, eighth from Iran, and ninth from the US. These are all published literature publications, all freely available on our website. And Palsy, you can do all treatments together. But yes, we do suggest to stick to a few so that you can really understand where the improvement is coming from. Now, I also told you that now we are added the integrative therapy. So I want to quickly share our experience of adding cell therapy, adding oxygen therapy to cell therapy and rehabilitation. So let's look at the effect of integrative therapies along with cell therapy in children with autism spectrum. So we looked at data of 100 and 100. In 100, we have done cell therapy with oxygen-based therapy. In 100, we have done only cell therapy with rehabilitation. So we can see the results now. So if you see the results, you can see here that the blue is only cell therapy with rehabilitation and red is cell therapy with integrative therapy. You see better attention concentration, better communication, better social behavior, but reduce in aggressiveness, reduction in self-injurious behavior, better in those with cell therapy and integrative therapy. So in most of the domains, you see better improvement, more percentage, almost 5 to 10% more improvement in when integrative therapy is added. If you look at the clinical scores, also we see that what I saw Indian School for Autism Assessment as well as the Childhood Autism Rating Scale. These two scales, when we look better outcome or more percentage of improvement in those children who have taken cellular therapy and integrative or oxygen-based therapy. Even in if you look at the difference, also the difference is more before and after the procedures when you take integrative therapies along with cell therapy. So when you combine cell therapy with HBOT and ozone, we find that effectiveness of cell therapy is improved. So let's see a few examples of children who have been treated, some recently, some very old. Now, this is a very beautiful example of a 19-year-old boy who's currently 19, who came to us almost 7-8 years back when he was 11 years old. When he came to us, he had fleeting eye contact, he had very low self-awareness, he had a lot of sensory issues, he had a lot of self-talking, he had a lot of temper tantrums and aggressive behavior, limited vocabulary, was in a special school, had poor eye contact, had hyperactivity. And after the treatment, we will see the progress first in 5 months. In 5 months, we saw that his reading level went from 3rd grade, 4th month to 7th grade, 1st month, 1 month reading level. So 4-year improvement within 5 months. So that much improvement in comprehension and reading happened. Eye contact improved significantly. Temper tantrums reduced. His sensory issues reduced. Personal judgment improved. Problem solving became better. He started going to the school, and he started going to normal school. His brain functioning improved in PET scan. His improvements also were seen in 2 years in his academic performance. You can see that he has got A, B, A and B in most of the subjects. So grade A in most subjects, and he passed with a GPA of 3.833. In over 7 years, people want to ask how are these children over a period of time? You can see over 7 years, a child who was mild autism within 3 years. 4 years actually went out of the spectrum. And this is him at the age of 19, such a handsome looking boy. He's passed, he's cleared his school, he's now given college applications, started college applications. He participated in choir. He did a trek, or he did a tour with his friends to different other countries in the world alone. So that's how he is now. This is his mother talking a few years back about his journey. I hope you can hear it.
I couldn't get him to engage with me. I couldn't get him to give me eye contact. Over time, he started to lose a lot of vocabulary. Right around 18 months to the age of 2 years, he just slid backwards.
He would flap like that, and he would walk on his tiptoes, look at the wall and be talking to the wall. Or he had problems with eye contact. He'd never look you.
I'm sorry.
Look you straight in the eye. He had problems with his speech. Some research and found out about NeuroGen. And the big question that I had in my own mind was, what is there to lose? And I could not come up with a good answer. And I said, we have to do it.
We started seeing better eye contact, definitely a difference in his engagement with us, with his sibling, his mood. He was so much calmer. Now he's all about taking his own shower. I have to just prompt him to get out, but he'll wash himself and he'll put his clothes on. Saw the PET scan images. I can't tell you the word. We were just so excited and thrilled. The areas that were hypoactive or non-active were warm. There was activity there. Ganesh has gone from the 3rd grade, 4th month reading level to a 7th grade, 1st month reading level in 5 months.
So this was a short video of him, and is almost reversed autism. And let's look at another experience of a child from Kenya. I'm sure you have.
We went to different doctors, we went to different hospitals, and when I brought it up, they were like, oh, no, don't worry, it's because they are boys, they are triplets, they were premature. I would be walking out and I'm like, bye, and no child is crying, no child is waving back bye. And by then, for sure, I knew that they should be doing that. The children had this behavior of disappearing. In fact, Eric disappeared 3 times in the middle of the night. the biting, the spitting, the scratching. How are we going to stop this behavior? We went to see the neurologist, and in 5 minutes, he said, these children are autistic.
As parents, it was very traumatizing. First of all, we didn't understand what autistic means.
So I decided to really get to read a lot about autism. I remember the first time I read about stem cell. I was like, wow, this is really good.
We had a lot of questions which we asked, and we got very clear answers from Dr. Sharma.
The day of the stem cell itself came, actually I was a bit anxious, of course, but really I didn't have fear. A bit of apprehension, anxiety, of course, as a mother, but I knew they're in good hands.
We put a needle in this pelvic bone and then we take out the bone marrow, which is the fluid inside the bone. The pure stem cells, once they are ready, a thin needle is inserted into the lower back. We inject the stem cells into the cerebrospinal fluid. It flows all the way up to the brain.
Things are to
We've seen a lot of improvement in terms of spitting. The tantrums have reduced. Sleeping used to be a problem before, but at the moment he is taken to his bed, it takes a few minutes and he is asleep.
Out of the triplets now, one of them is
see my son's psycho. You try to make them understand what it is to pedo, and they couldn't. But after stem cell, when we arrived in Kenya the following day and we went out, and these guys could psycho. I'm going to send you to buy tomato paste, okay? I'm going to send you to buy what?
Tomato paste.
In the shop. Where is the shop?
It's here.
Okay. So I'm going to give you
Money.
for what?
Buy tomato lollipop. I'm going to wear my shoes. That's right.
Here is going to buy tomato lollipop. Let's see what happens.
Parents ask me, so do you really think stem cell works? And I'm like, I can see changes, I can touch, I can feel, I can smell. Of course, for me, stem cell works. I'll do it until my children get well.
Well, here, there is Mercy's story. Please do look up. These children have grown a lot. This was almost 3-4 years back, and now they've made so much progress. There's another child from Kenya who came to us when he was 13 years old. He was practically locked inside home. He was extremely aggressive, very hyperactive. He had no awareness, no understanding. After the treatment, slowly his sitting better became better, his concentration. He followed commands better. He is more manageable. He could go to a special school. He could do activities. He could socialize better. And so he started to vocalize also. He started doing swimming and cycling. So this happened after 13 years. So earlier you do better the results. And we will see an example of a child who started very early with us, and he is now better than his peers in his comprehension and understanding as well. So this is here is Victor from Kenya, swimming and cycling. And let's look at another child from South Africa. He came to us first when he was 4 years. On the left side, you can see before. And a year later, you can see he's much better. Earlier, he would not sit. He would not understand. He would be very, very stressed up. Treatment over a year, his sitting tolerance improved. He started understanding. He started verbalizing a little bit from non-verbal, he went to a few words. The task he could do, he could understand color concept, he completed task, but he was still very, very early verbal at that time. So first time he came, he was 4 years. Second time he was 5 years old. So this is a journey of a year, which you are seeing here. Problem solving improved. He could do puzzles. Now, after a year, what happened after that is what I'm going to show you. So this is 4 years, 5 years. And now what I'm going to show you is after 3 years. So 2017, 2018, and then 2020, November, right in middle of COVID, this is what the mother sends to me, a video on WhatsApp with this message.
Once upon a time, Pete the cat was walking down the street and his brain knew white shoes. Pete loves his white shoes so much.
He was completely non-verbal and autistic, and now mother said
I love my white shoes. I love my white shoes. I love
stories. He's better in reading than his peers. That's what she says. The foundation which started with
Pete standing in a large pile
the roots have become stronger.
Strawberries. What color did it turn?
He's making his own story. Nobody's telling him, prompting him. And he's recording it on his own. This is a 3-minute story, so I'm not
goodness, no.
Just to show you.
He can walking along and singing his song. I love my red shoes, I love my red shoes, I love my red shoes.
So that was Zachary. Another child. This child was motor focus improved, much more focused. Obstacle became less. He needed less prompts to do activities as compared to earlier. Less of support. More focus, more concentration, less distraction. Better eye contact. Point out better eye contact. You can see earlier he was not allowing oral motor, now he's allowing motor activities. Better motor power. These are few examples. There are many more examples. So now I'm going to next, that is cerebral palsy. And cerebral palsy we know is severe damage to the brain due to possibly lack of oxygen or infections or hypoglycemia, and can be caused due to various reasons depending on the type area of the brain which is damaged or how much the brain is damaged. You can either have one side of the body is damaged or the full body or lower part of the body is affected. So this is the PET scan which shows us the black area is completely dead, the blue area is functioning less. Here you can see medication. What is the treatment generally for cerebral palsy? It is either medicine to reduce the fits or seizures or reduce the tightness, orthotics or splints, Botox required, rehabilitation and surgery sometimes for very severe spasticity. So what kind of results do we see in cerebral palsy? If you see this, let me show you a few examples. I think that will give you a better idea. Generally, what we find is that the brain functioning improves. This is a PET scan. The blue area are low functioning, black is dead. This is before the treatment. After the treatment, you can see that the blue area have become green. So it takes about 6 months to see the changes in the brain. You can see here before the treatment, the blue areas, and then you can see the green. So this is the improvement in the brain functioning. Here you can see a lot of blue area, all the damage is now, it is better green. So these are our publications. Let us see a few examples. This is an example of a 7-year-old child from a place known as West Bengal in India, who came to us with severity of 4. So 5 is the most severe, 4 is slightly better, 3 is better. So he came with a moderate to severe cerebral palsy where he was unable to sit or stand. He had no eye contact, could not speak, he had poor command following, and in 22 months, less than 2 years, he is now able to walk, he is able to go to school, he is able to sit, of course, he is able to speak in full sentences, he is able to go to school and study. So that's the improvement he's had. His severity came down from 4 to 3 and his balance improved. This is the scan before the treatment. We can see a lot of blue areas here. This all the blue damage is now more green. So more the green, more the yellow, better the brain functioning is. This is example from Kenya. This child came to us when he was 14 years old, a quadriplegic CP on wheelchair. So 14-year-old child on wheelchair. You can see first he came on wheelchair, hand functioning was low. After the treatment, hand functioning improved. He started wearing his own clothes. He started, filling his own bag because he goes to school. Cognitively, he is good. Now, after the treatment, he started opening the fridge, opening the bottle. See, these are also important for him. Using the phone, plugging the phone, and now you can see he can walk without support. So this took about a couple of years, but after the treatment, they did very good rehabilitation, and you can see the child is walking. So a 14-year-old child can walk. I'm sure if you work well on your child, he or she will also walk. A 6-year-old cerebral palsy, a lot of involuntary movements. He could not crawl, could not sit, stand, and had difficulty in fine motor activity. Speech was very unclear. Now after the treatment, cognition has improved. He can tell body parts. He can identify animals, letters and pictures. So cognition improved, speech improved, his hand functioning improved, his crawling improved. You can see that he is now able to crawl better. He's able to do knee walking better. He doesn't need much support. He's able to get up and sit and walk on its own, though with little difficulty, but still most of the activities are now independent. He can go to school and study as well. And see here, he was falling down on the left side, and now he is able to get up and walk on its own. So stability is there. It is not 100% normal. But he's walking without support. That's most important. He's doing gross motor activities without support. And he's now started climbing stairs with support. He's doing motor tasks. He's climbing stairs. There's another child from Kenya. When he came to a 7-year-old, he could not stand. He needed support. You can see completely on support before the treatment, and slowly you could see now that walking has improved, and he can now walk without support now. This is inside the home and now outside the home. So this is the progress that even though he was 7 years old, with about a year and a half came this progress. So this is a brain scan before and after the treatment. This is a very severe child, about 6 years old when he came to us. No neck holding, no sitting. Slowly his sitting improved. You can see he had no control over the body, and then slowly body control started much better. Sitting became better. Here there is no sitting. You can see sitting better. Sorry, got stuck, I think. Yeah. More awareness, more better sitting balance. We started training him to get up. He's trying to get up. Earlier, he was completely floppy. He didn't have any control over body. Now, slowly, body control started, and then we started making him walk with support. So this is how slowly, steadily, the child is trained. Child from Nigeria. Earlier, you can see completely neck down. He had gone on the swing with so much support. He had no awareness. Now you can see that he is able to take weight much better on all fours. He is able to stand much more erect. He doesn't need so much support. More awareness. You can see looking around. started to also take steps. And now you can see he's also attempting. So this is over a period of 6 to 9 months. There are a lot of such examples. Now I'm going to go to intellectual disability, or what is commonly known as mental retardation. Again, you can see brain functioning in these children is affected. And with cell therapy, this is the first time that we have shown that cell therapy works, bone marrow derived cell therapy works in intellectual disability. This was shown in 58 patients. We looked at 29, where the blue indicates cell therapy and orange indicates only rehabilitation. So you can see that in only rehabilitation also there is mild to moderate improvement. When you see in the blue, you can see significant improvement in maximum patients. So that is the difference, that when you do cell therapy with rehabilitation, the effect becomes better, it enhances, and you can see better results after the cell therapy when you do rehabilitation. Rehabilitation is very important, but when you do in conjuncture together with cell therapy, you see better results. You can see the brain here, there's a lot of damage. All these blue areas now become green. So as brain gets activated, now you do the training, the better connections and better outcome. These are a few examples before and 6 months later. It takes at least 6 months to see the difference. So this is an example of a 20-year-old boy. So 20-year-old, he came from a small place in India known as Andhra Pradesh. And at that time, his mental age or social age was just 9 years old. So 20-year-old boy with a 9-year-old brain. He had difficulty in reading, difficulty in writing. He could not play out physically. He was not very strong. He could not speak in full sentences. He had very poor mathematical calculation. His social behavior was affected, so he could not play with other children. He could not go out of the house alone. He could not go to buy groceries, even at the age of 20. He did not know simple calculations for money. After the treatment, over a period of 2 years, we have been following up. He comes to us repeatedly for follow-up. Now he's able to complete his school activities, able to do mathematical calculations. He's able to go and buy groceries. He helps his father in the shop. He is now able to communicate and converse with his friends. Now he is able to cook some small items for himself. His social age improved. From 8 years. So this is the last 5 minutes of my presentation. Then I will take questions. So no major adverse events or complications, no neurological deterioration because we are using the patient's own cells. If there are only what we do see sometimes, we have to be cautious about fits, seizures, or convulsions. If there is a history of seizure or if EEG is abnormal, then there is a 3 to 6% chance of having a seizure after the treatment. No, sometimes children have something known as a spinal headache after the treatment, which may last for 2 to 3 days, and some pain or nausea, vomiting. So this is NeuroGen Brain and Spine Institute. All of you are welcome here, and we treat all our patients like family. We have treated over 13,000 patients from 75 different countries. This is NeuroGen Hospital, where it's in a beautiful city, not the main Mumbai, but away from Mumbai, near a beautiful lake. It's a very beautiful area. Those who have come here can vouch for it. This is our very special operation theater where the procedure is done, and this is our cell laboratory where the cell separation happens. It is within the operation theater complex, so nothing goes out of the operation theater. Comprehensive rehabilitation under one roof, a combination of cell therapy with neurorehabilitation, and it's a team of all doctors and therapists together. And each therapist has the utility, and they work together as a team for each child. So this is a physiotherapy unit, adult physiotherapy unit. Then this is occupational therapy. Autism Child Development Center, specifically for children with autism. Aquatic therapy. These are special therapies. Children love water and they respond very well in water. This is how exercise in water is done, which helps for mobility as well as for focus and concentration. This is called spinal cord injury walking track. This is for adult patients with spine or brain damage. Special therapy is done for them. Sensory integration therapy for children with autism. Occupational therapy, including activities of living, speech therapy, special education, art-based therapy. And of course, our anti-aging, along with NeuroGen, now we also have our anti-aging program for non-neurological conditions, where we combine hyperbaric oxygen, ozone, gut cleansing for adults, infrared cryo preservation, vitamins for other ailments. For neurological conditions, a lot of books, both for professionals and for parents and caretakers, freely available online. This is our whole team of seniors who supervise and monitor all the work and are part of the treatment. Dr. Alok Sharma, he is the neurosurgeon director of NeuroGen, the vision or visionary behind this whole project or integrated holistic approach. Myself, Dr. Nandini Gokulchandran, my specialty is neurological disorders or neurodevelopment. My focus, my background is use of or research in brain development using cell and stem cells. Dr. Jacob is a very, very senior neurophysiotherapist and heads the neurorehabilitation. Dr. Prerna Bade focused on a neuropathologist focused on regenerative medicine. And Dr. Himangi Sane, the head of research as well as one of the deputy director, herself a patient of amyotrophic lateral sclerosis and motor neuron disease. We are ISO and GLP GMP certified. That shows our quality. We have been awarded many different international and domestic awards, European, international and national awards for the work in stem cell and disabilities. So you can reach us on this website, neurogenbsi.com. This is our email. We will send you all this information. Each patient is given a coordinator who will coordinate with you. We have two types of programs, a 1-week program and a 2-week program. In a 1-week program, you arrive on a Sunday. Sunday and Monday is all evaluations, clinical as well as blood workup and brain scans. Then the one day, that is Tuesday, is generally the cell therapy, and Wednesday to Saturday is the rehabilitation. That's a 1-week program. Then we have a 2-week program where we have added on the integrative therapy or oxygen-based therapy. The first 3 days are similar. However, from Wednesday onwards, along with rehabilitation, you also have integrative therapies and you are discharged or you are allowed to go back the next Saturday. Now, how are we different from other? There are a lot of centers around the world and in India who treat, use cell therapy or stem cells for various patients. And how is NeuroGen different? The most important thing about NeuroGen is, as the name suggests, we are focused only on neurological cases. That is our specialty, and that we have been doing so for the last 15 years. We use very safe cells. We use safe autologous cells taken from the patient's own body, injected into the spinal fluid, so that it is focused approach and there are no long-term side effects because there are no rejection issues. We have added along, we keep on evolving, and along with cell therapy, a very comprehensive holistic approach of neurorehabilitation and oxygen-based therapy. We have treated over 13,000 patients from 75 different countries in the last 15 years. The core team is a team of neuro specialists focused on neurological conditions and who monitor everything. So we are a group of very experienced professionals. Along with treatment, we also do a lot of research, and we have over 100 international publications, which no other center has. We are experts, and hence we have written book chapters on various neurological conditions and cell therapy, and we constantly keep on researching. And our work is monitored by our ethics committee, which is government approved. So this is our specialty and how we are different from other people. We use very safe autologous cells, and we found that it is safe and effective for neurological conditions. And we believe that it is difficult, how it is possible to help children and individuals with neurological condition to regain independence, to gain independence, and to lead a constructive, productive life.
Scientists believe these tiny cells may have the potential to help us understand and possibly cure some of our most devastating diseases and conditions, to regenerate the severed spinal cord and lift someone from a wheelchair, to spur insulin production and spare a child from a lifetime of needles, to treat Parkinson's, cancer, heart disease, and others that affect millions of Americans and the people who love them. Today, with the executive order I am about to sign, we will bring the change that so many scientists and researchers, doctors and innovators, patients and loved ones have hoped for and fought for these past 8 years. We will lift the ban on federal funding for promising embryonic stem cell research.
Because many people ask us.
There's no finish line in the work of science.
Many people ask us that whether it is US FDA approved, and this is the answer to it, that in the US, the embryonic stem cell research was stopped almost in 2001. And however, in 2008, Barack Obama lifted this particular federal ban. However, during that last 8 years, when work had stopped in the US, the other parts of the world started taking up more interest in regenerative medicine and found ethically acceptable sources of cells, and that is the adult stem cell. So there are no issues with adult stem cells. And to quote Barack Obama, this beautiful
scientists believe these tiny cells may have the potential to help us understand and possibly cure some of our most devastating diseases and conditions, to regenerate the severed spinal cord and lift someone from a wheelchair, to spur insulin production and spare a child from a lifetime of needles, to treat Parkinson's, cancer, heart disease, and others that affect millions of Americans and the people who love them. Today, with the executive order I am about to sign, we will bring change that so many scientists and researchers, doctors and innovators, patients and loved ones have hoped for and fought for these past 8 years. We will lift the ban on federal funding for promising embryonic stem cell research. There's no finish line in the work of science. The race is always with us. The urgent work of giving substance to hope and answering those many bedside prayers, of seeking a day when words like terminal and incurable are potentially retired from our vocabulary.
That's what is a mission of NeuroGen. That's what is a vision of NeuroGen, to make possible a cure for incurable disorders of the brain. So I hope this talk brings a ray of hope to you that there is possibility, that all is not lost. And this is the NeuroGen Brain and Spine Institute. You are welcome to come here. We treat our patient like our own family, and you will feel the difference. I'm happy to answer questions. Please put your questions in the question answer box, and I'm going to now read out the questions and come back to you. The first question is from Godfrey. Are there any side effects of autism cells, stem cells for autism? As I explained to you, there are different types of stem cells used. The cells that we use are from the patient's own body, and hence no long-term side effects. Minor side effects may be there, but these are short-term and can be taken care of. Irene is asking whether a 10.5 years boy with features of autism or ADHD can get promising result from stem cells, or is it too late? It's never too late. We have treated even 20-25-year-old. However, yes, earlier you bring, better and faster the results. And even at the age of 10 or 15, it is possible to do the treatment. So we can evaluate each case. We would like to understand how severe the problem is, and then we can give you realistic expectations. Can my son, Anne wants to know, can my son with severe cerebral palsy benefit from stem cell therapy at 10 years? We would like to see how severe it is. If there are no deformities, if the hands and legs are not completely bent, then yes, it is possible to help your child. We would be reaching out to you, and either me or my juniors will be talking to you about each child, and we will address your concerns and help you understand the possibilities. Adam says, at which ASD severity. Is ASD recommended? Mild, moderate, or severe? I'm asking. No experience of a child with mild or moderate who ever went STD, is it contraindicated? Absolutely not. I think I showed you a few examples of, in fact, mild can get out of autism much faster with cell therapy. In fact, if you heard me, there is the triplets. The triplets, in fact, are a very good example. One, Rick, was very mild and he's now out of the autism spectrum. Eric was moderate, he's going towards mild, and Lenny, severe, is now towards moderate. So there is no contraindication, whether mild, moderate, or severe. All three can be treated with cell therapy. What is the risk of convulsional seizures and what is the risk of malignancy? There is no risk of malignancy with adult stem cells. With cells taken in the bone marrow, there is no risk of malignancy. As far as convulsions or seizures are concerned, there is a 3 to 6% risk if there is a history of seizure or if the EEG is abnormal. However, this risk is very transient and can be treated. When there is no history of seizures or EEG is absolutely normal, then the risk may be 0.01%. So 1 out of 1,000. 0.1%. How much is the procedure? So this we will reach out to you and connect to you about the logistics. One of my colleagues will get in touch with you. With regards to muscular dystrophy, is there a stem cell therapy and what side effects? I'm sorry, I didn't speak about muscular dystrophy, but yes, we do treat children with muscular dystrophy. In muscular dystrophy, the focus is different. Muscular dystrophy is a genetic condition where muscles keep on degenerating. In muscular dystrophy, the focus is to stabilize the condition and prevent further complications or deterioration. There are no side effects because we are again using the child's own cells, but the result will depend on how severe the muscle weakness is. How many times should a child have stem cell therapy? Yes, CP quadriplegic. So when the child comes to us, we do a complete assessment. Clinical assessment, we do brain scans, and thereby after that we can give you a realistic expectation how many times treatment may need to be done to get functional recovery. So every child is different. Some may need only 1 and some may need 2 or 3. So but between first and the second there would be a 6-month gap. We recommend at least 6 months gap in order to see improvement, because it takes 3 to 6 months to see the improvement. Many studies that have been done, long-term effect after stem cell, yes. We keep on studying. In fact, we keep on studying all our patients. We have a follow-up of about 15 years now. So we do see children coming back to us after 4 years, 5 years, 6 years. Yes. Are there any evidence of 100% cure to autistic ones? So first of all, we have to understand that autism is not a disease. It is a condition. It is a spectrum. Some children may be very mild, some may be very severe. The focus is not to cure. The focus is not to change. The focus is to empower. Focus is to make the child independent so that he can lead a functionally independent life. So yes, there are many children who are now off the spectrum and are going towards, academics and learning and having their own job and possibly marrying also. I'm 29-year-old with Mioshi myopathy. Okay, Sufyan. Health is getting weaker. I'm unable to walk. Do you think it can help? And how long will the stem cell work after the treatment? So for a Mioshi myopathy, if you have stopped walking but if you don't have deformities, we should be able to make you walk with support. Okay, it all depends on what your muscle power is at this point. So we would like to evaluate that. And yes, in muscular dystrophy, it is not a permanent cure. The effect, the cells will work. However, because we are basically balancing muscle degeneration versus stabilization, the effect, we may have to repeat the treatment periodically, maybe between 6 months to a year, to be able to have the impact longer. So we will need to really understand your case better. For how long can the treatment reach conclusion? So Progestus, I didn't understand your question. Do you mean to say when you see the improvement? We see the improvement over 3 to 6 years. And we have seen the child who started as mild to moderate, if he comes to us in less than 5 years, in about 3 to 4 years, we find that they are able to come out of the spectrum. Afsha, is there a definite cure through stem cell therapy, and what are the costs and which condition are you talking about? Again, we never use the word cure for conditions. We are looking at functional improvement and independence. In case of neurological disorder, we have to change our perception and focus about the conditions. If you look at hypertension or diabetes, we don't have a cure for these conditions also, isn't it? Even for cancer, but we treat, we help improve the quality of life. We help improve the child's condition so that he can become independent. How are you involved with spine and cancer complications? There are no spine and cancer complications with adult stem cells, and we do not treat cancer patients. So no, we have been treating for 15 years, and there is no literature which says that their cancer can be formed, or our experience says that there is no cancer. Afsha's child has muscular dystrophy, LAMA. So it's like a congenital muscular dystrophy, laminin 2 deficiency. Afsha, there is no cure for muscular dystrophy. Again, I'm telling you, we are looking at slowing down the deterioration. So not a cure, but slowing down the deterioration. Any other questions? So for all the participants of this webinar, the webinar link will be shared with you. Plus, we will be getting in touch with you individually, and we can have a one-on-one and evaluate your condition or your child's condition and help you understand the treatment possibilities better. Can we contact for further question? You will be contacted, Lee. Within the next 2 days, you will get an email and you could respond, or you could, the contacts are there on the screen. You can reach out to us at contact@neurogenbsi.com or reach out as 9920-200-400 +91 9920-200-400. And we will also, since we have your contact emails, we will get in touch with you and you can then correspond or communicate with us. My colleague Latika Patel will be in touch with you regarding any logistics issue and will connect you to doctors if required. What is the success rate in LAMA, and can the progress cause more? The possibility of success is about 90%. The progress cause more damage? I didn't understand this. The treatment will not cause damage. However, the possibility in muscular dystrophy that the child continues to deteriorate is there. So will need to be evaluated. Lee, yes, we will help you with the visa issues as well. So the way we help is that we will give you a letter for medical visa invitation, and you will need to produce that as a part of your visa application process. And yes, so we will be able to help you in visa. So the treatment, the way that we take care of you is start to end, right from helping you get the visa, as well as once you plan to come, you'll be picked up from the airport, you'll be brought to the hospital, taken care of completely in terms of the stay, the food, and then treatment, and then go back. And each patient has a case manager who's a therapist and who will be in touch with you even when you go back home. So we will be following up with you even when you go back home. Do you need us to take the child for checkup? Because we did a checkup a little ago, but we have results. So one of our doctors will be communicating with you, looking at all the results that you have. And if anything specific is required, then we will let you know. But generally, if the child is in good health, once you come here, we will do all the checkups. If there are no more questions, then I'll let you go, but we will be in touch with you. So if you have any more questions, you can definitely send us an email and we will be in touch with you in the next 2 days. Have a great evening and hope to see you soon in India. Take care. Stop share. Huh? And webinar.